Welcome back to Living Local. Vera French Community Mental Health Center has made it easier for folks in our area to get the help they need by expanding and renovating their clinics. While construction is still ongoing, they want to remind visitors that they are still open. And here to give us an update on how construction is going, Dr. Rich Whitaker, CEO of Vera French Community Mental Health Center. Thank you for being here today.
You're welcome. It's great to be here. Thank you.
Yes, awesome to meet you. So, okay, Vera French had a groundbreaking expansion. Could you tell us a little bit more about how that's going for you?
Yeah, you know, ever since we broke ground, we have made quite a few changes already. One thing is we had to take everything that was in the very front of the building and move it to the back of the building.
Right.
So all of our front desk people and intake and all of that, that's all now in the back of the building, so that we have all of our clients parking in the back and coming in the back way at our Central Park clinic.
Okay.
But construction has started. We've got big machines right out in front of the building. So.
Okay, and how is this new expansion going to help people receive services at your clinic?
Well, I tell you what, one of the things that I noticed when I was brand new at Vera French, even when I was interviewing, walking up those front steps, I thought people struggle up these steps every day, I guarantee you. And then I've watched that happen over the last 7.5 years that I've been there.
Okay.
And this will actually put an indoor ramp for people with walkers and other mobility challenges right at the front of the building, so they don't have to go to the back.
Right.
You know, and come in through the back door. They can come right in through the front door. Sliding doors,
Perfect.
Lots of open waiting room space. Right now, the way it was, we could accommodate maybe 20, 25 people in the waiting room.
Okay.
With the new space, we'll be able to accommodate up to 45 people in the waiting room.
That's amazing.
Yeah, and windows everywhere, just bright and open and very obvious which way you go, and all of the services right up front. Yeah.
Okay, awesome. Now you mentioned you were still open, so how are you servicing people through the construction?
Well, you know, so all of our front desk is in what used to be kind of a training area, and I think people like it.
Okay.
It's brighter, it's more open than our previous waiting rooms were, you know, the original.
Yeah.
But everybody has to park in the back, and that's really the only real inconvenience, because then there's a little bit of a walk to get to maybe your doctor or therapist's office, which is more towards the front.
Okay,
And then the pharmacy is still where it's always been. So people going to the pharmacy have to make the long walk down the hall, get to the pharmacy.
Okay.
But otherwise, everything's still going just as it always has. Yeah, all of our services are up and rolling, and we're even hoping to open up our second transcranial magnetic stimulation chair.
Wow.
That should be open sometime in October. Maybe early November at the very latest. Okay. But that's in the midst of all this going on.
So pretty soon then. I mean, time is flying.
I
feel like we're already at the beginning of August almost.
Yeah, summer is going too fast for me.
It is. It needs to slow down just a little bit.
Right.
So with the construction, you mentioned things have been going well, but has it caused any messes for people there at the clinic or anything?
You know, a little bit of confusion at first with where to park. People didn't know where to come in. But I think people have gotten used to that, and now that there's fences up and big construction happening and the parking lot's all torn up in the front, everybody knows, oh, I got to go around to the back.
Okay.
And hopefully that's working out. But yeah, they're actually putting in concrete piers because, you know, that it's an old building, and there are some ancient geological kinds of like a lake that used to be there, so they've got to really put this new addition on something solid. So they're putting in concrete piers and making this what's going to last a long time, probably another 50 years at least.
That's good. That's what we need.
Right.
That's what we need.
Right.
So what do you think will be next at the clinic there?
Well, you know, we are really excited that this will give us more space and free up some of our office space to add some more clinicians.
Okay.
Now, Vera French overall, we're also, you know, adding 30 apartments because we do Vera French housing as well.
Wow.
And so there are 30 apartments that are being built right next door to our Carroll Center at 808 North Harrison. And that's starting up in the next couple of weeks as well. So we'll have 2 big construction projects happening at the same time right here in Davenport.
Wow, so a lot of the good things are happening at Vera French over the next year, or even the next year.
Yeah, it's going to be probably about a year before those apartments are done, but only about 6 months before we're actually using this new space. We're hoping to be in it just after the new year. So.
And before you know it, those 6 months will fly by.
I know.
But that's really good, though. It's really good to hear that you're trying to continue to improve in the community. And how have you kind of seen it grown since you first started there?
Well, so first of all, the goal is really not to grow Vera French. It's just to help solve big community problems.
Right.
And as we tackle new things, it seems like sometimes we have to grow a little bit. So we have grown. We were less than 200 staff before I started. Now we're over 230 something, 235 I think at the latest count, or 240 staff members. But really, adding services is really the exciting thing, because that's where we're actually able to make a difference. And adding services for those with substance use disorder challenges. We call it co-occurring disorders, though, because we always know there's that mental health and other life issues behind that substance use. And we're doing something called co-responder. Maybe we'll talk about that some other time and have some of our folks here to talk about that, but riding along with our law enforcement. So very exciting
that'd be
new
interesting
developments.
to see the kind of behind the scenes of that too.
Mm-hmm.
I like it.
Yeah.
Well, thank you so much, Dr. Richard, for being here today. I really appreciate it. I love to hear all the things that Vera French is getting into here. And of course, this segment was sponsored by Vera French Community Mental Health Center. For more information, go to verafrenchmhc.org. We'll also have those details posted on ourquadcities.com.